Coming up on My API Health.
We'll practice a mindfulness exercise to bring balance to your mind and body, and will effectively deal with stress, anxiety, and anger. Then, we'll head to the Asian American Resource Center to speak with Doan about the upcoming AAPI Community Health Fair in July.
Hi guys, so we are here at Asian American Resource Center, and we're going to go inside and take a look around and speak with Doan. So come on in, let's take a look.
So invite your family, sit down and relax, because My API Health starts right now.
Hello, aunties, uncles, friends, and allies. Welcome to the newest season of My API Health, where you'll receive accessible, pertinent information. We strive to be culturally informed in our programming by discussing bigger topics that many of us living in America are concerned about. Also, happy Pride Month to everyone out there. I'm your host, 𝗙់𝘁𝗆, and you are in for a great show today. And if you're joining us for the first time, allow me to welcome you to our show. The information presented is particular to the Asian community, yet it is still relevant to the greater Austin communities. Language access is very integral to this creation of this show, and its unique platform offers it in 3 other languages: Burmese, Mandarin Chinese, and Vietnamese, so that we can expand our reach to people proficient in another language. You can find each of these languages for this show on our YouTube channel or in the video description below. Let's start off with an easy mindfulness exercise to help increase a sense of positivity and calmness throughout the mind and body. And before we begin, it is important that you feel at ease while you're doing these practices. So if for some reason you feel uncomfortable, or if you experience unsettling feelings, then please take care of yourself as you see fit. And you may stop this practice at any time. So join me and let's begin. This mindfulness exercise is one that helps to bring balance to your mind and body, and it helps to regulate your natural rhythms, and it's also very effective with dealing with stress, anxiety, and anger. It is called box breathing, or can also be called square breathing. And remember that the breath is what connects our minds to our bodies. It is the bridge, and it is the function by which we are kept alive. And that's why when we pay attention to our breathing, we're actually paying attention and connecting to something deeper that brings us into the present moment. And by becoming present through different breathing techniques, such as the one we're about to practice, we can tap into our nervous system. The breath brings oxygen into our system and it calms it down almost immediately. So when we feel angry or anxious, this breathing technique will definitely help to change your mood for the better, and it can help to move us from a state of stress, anxiety, or anger into a more emotionally stable and peaceful state of mind. This breathing practice can come in handy anytime that you're feeling these kinds of intense emotions. People of all ages, especially children, can learn this easily to help them manage their very big feelings. And the earlier we learn these techniques, the more we all benefit. So I invite you and the family to take a seat that's comfortable and breathe normally through the nose, relaxing the body. And you may keep your palms facing up, resting on your legs. And for better concentration, you may close the eyes or keep your gaze turned downward. Or you may also just keep them open. Now pay attention to the breath and how the body continues to relax throughout this practice. And now we'll inhale for 4 counts. 1, 2, 3, 4. And hold the breath here for 4 counts. 1, 2, 3, 4. And exhale through the nose for 4 counts. 1, 2, 3, 4. Hold the breath out for 4 counts. 1, 2, 3, 4. Now this forms a sort of box. So let's try this again. Breathing in and out through the nose. Okay? Breathe in, 2, 3, 4. Hold, 2, 3, 4. Breathe out, 2, 3, 4. And hold, 2, 3, 4. Again, bring your attention to the mind and the body. What stands out to you most about this practice? Do you feel a little quieter in the mind? Do you feel calmness enough to move forward with your day in a peaceful state? I know I do. So I hope that this was helpful to you and that you and your family can carry this calmness wherever you go. Hi guys, so we are here at Asian American Resource Center, and we're gonna go inside and take a look around and speak with Van Doan. So come on in, let's take a look. Hey Van.
Hi, 𝗙liche.
How are you?
Good to see you.
Good to see you. Yeah, I wanna take a look at AARC, but before we go inside, I'd love to learn more about the sculpture here.
Yeah, so this is our lotus sculpture by 𝗙anye Chung. She had installed this back in 2013 when this building was built.
Awesome, it's very beautiful. It's amazing. So shall we go inside and check out the rest of the space? Come on.
So this is the ballroom we're gonna have the health fair majority at in.
It's a very big space to accommodate all 300 plus people.
Some parts is we're gonna do the food bank, passing out the delivery, and then the stage is where we're gonna do the raffle.
We'll do the giveaways there.
And we'll have some tables over there.
We'll have our vendors over here, and then our screeners, health screeners, and immunization team will be towards the back of the ballroom.
And then we can go out to the lobby where really a lot of the check-in is going to take place, where, especially in the morning. We're going to have like some tables out here to accommodate for the 4 or 5 main languages in the check-in.
Yep.
And then in the back, right here of the foyer, is going to be a seating area to support for registration, for translation and interpretation for the check-in.
So as folks come in, they'll be able to register, grab what they need, and then they'll go in through here into the main ballroom where the main event will take place.
And then we'll have staff and volunteers really helping ushering and showing them around the place.
Awesome. Very excited. Well, that was really exciting to go around and visit the Asian American Resource Center and learn more about what kind of services that they offer here and the different kinds of art exhibits that they have. But now I'd like to turn to you, Van, and learn more about you.
Hi, thanks for having me.
Great. So I just want to start off with, what is your current role at AARC, and what do you do?
So my current role at the AARC is I am the education coordinator, one of the education coordinator, and I'm doing a lot of like youth programming. Our past that we worked with is a teen mentorship program, working with high school juniors and seniors, and then pairing them up with mentors who are part of the Asian American community professionals. And then in this 5-month-long course, we had 2 phases, where the first phase, the students were learning about Asian American history and their culture, and then just having conversations about identity work. And then the second phase was the mentors also guided them through their professional careers, and their interests. And also they did a capstone project where they wrote a book actually about the Asian American experience for teens, and they interviewed Asian American professionals, leaders, personnel in Austin, and they wrote a book and then illustrated a book, and it was showcased at our 𝗙cie𝗹𝗹𝟐 annual event.
Oh, that's amazing.
Yeah, it was really neat. It's our first time ever, and so we got a lot of good feedback, and they had a really good time. And a lot of feedback we got from both the mentors and mentees was like, this is the first time they had a space where they could meet other individuals, youth, similar to them, and then be able to have like a space where they discuss all these different factors that affected them. So we had a good time.
Wow. That's really cool to have something like that kind of mentorship program for the youth, because I think that's something, I know I didn't grow up with that.
Same thing too, and when we talked to the different mentors, they mentioned the same thing, like they wish they had somebody that can help them just outside of their family, right? It's different from family, but another individual that they can connect to and like really speak about like their concerns or worries, what does it mean to be Asian American, growing up in the U.S., the States, and their experiences, and they're able to relate some of this away from the family, the Asian, family.
Right. So
pressures.
speaking of Asian American experience, what brought you to AARC?
It just by chance as well, because I moved here to Texas and then to Austin, and I have a social work background, and so I was doing direct practice before, and I was just missing that community work, which I used to do. I was trying to figure out what I want to do with my population. I did work in Houston for a nonprofit with the Vietnamese Americans and immigrants, and then just coming back here, I just wanted to find that community again. And then moving to Austin, you're trying to figure out where things are, and so it just happened that like, oh, AARC was hiring. I was like, and I worked with seniors before, and it just by chance became that way, and then here I am.
That's amazing. What a neat journey from Houston to here, yeah?
Yeah, well, before that too, Nebraska, Houston, and here.
Okay. Wow. Well, talk about a little bit of the different kinds of programmings that you do have, because you talked a little bit about the Asian American youth, and then anything else that you have going on that's specific to different age groups.
Yeah, so at the AARC, we're such a unique space where it's a culture center that is part of the state of Austin. We're the only center in the country that it's like that. And so we get a lot of support community and also from the city. We're part of the museum and culture center of the city. And the current programs we have is we have a very active senior program with many different cultural diversities and Pan-Asian identities. And so they meet here from Monday to Thursday, 10 to about after 1, where there's wellness in the morning, there's lunch provided by Meals on Wheels in the afternoon, there's different activities from technology classes to educational courses. There's the diabetes by APH, we did advanced healthcare planning. Some of them just want to play ping pong or game room, hang out with their friends. So we have a very diverse group here. In the morning classes, we have like yoga, Bollywood, Tai Chi, so just very variety. And that's our biggest ongoing year-round. We have exhibits program where we try to showcase Asian American artists throughout the year, and so there's rotating exhibits going on. And other than that, our youth program, we have one off. Besides the teen mentorship, we also have a middle school program called Youth Voices Rising that in partnership with like the city, the UT's Asian American Center, where we do Asian American studies for the middle school age. And then we have like, our annual 𝗙cie𝗹𝗹𝟐 to celebrate Heritage Month. And just other programs and collaborations throughout the year with different nonprofit and organizations that reach out to us. Our adult programming, we have a book club, Asian American Book Club. And yeah, just a lot of different programming that occurs throughout the year.
I love to hear about how much you have culturally specific programming and how much you've been a leader in that, as well as like the seniors. Our seniors are always kind of an afterthought often, and I think that it's important for those who are, especially with such immense, vast immigrant journeys and experiences that they all bring, and being a daughter of immigrant parents, I know how isolating it can be if you're a newly arrived person, or you know, you just have been in an area where you don't have access to transportation or what have you. You know, so it's really, really amazing to see that there's a department, a center here that is through the city that is specifically for these different age groups, and our seniors are not left behind, and that we can actually like help with them getting acclimated and having them be active, and it's really great.
Yeah, it's a really neat space where, like, you know, and we try to be more culturally sensitive in the programming that we do, more targeted, and just knowing, like, we do get a lot of feedback. So after we do like a program or something, you know, we try to get the seniors feedback. It's like, this is a good fit. It's not, then we try to bring other folks and community members in. And so we've grown a lot to the space is getting tight for our seniors. Like, they want more space, but, and it's just the type of programming they really appreciate.
That's amazing. And 𝗙ecie𝗹𝗹cie, I did attend that, and it was fantastic. What a great event it is every year to have art exhibits and so many different levels and layers of activities and things like that you have going on here. So let's talk about our annual AAPI Community Health Fair. The Awesome Public Health partners with AARC, as well as our community-based organization 𝗙ecie, which is another partner of ours. And we put together this amazing health fair on an annual basis, and it is also here at AARC.
So that's one of our annual, also signature event that we work with 𝗙cie and with APH, and I think this is our 6th or 7th year. It's my 4th year being involved, but this is our 6th, 7th year, and it's grown a lot, and we've increased from, like, I think from the beginning was just a few languages or targeted population, but now it's grown to like 8 or 9 languages. And the goal of the health fair is really bringing these resources to communities that need the services. So our focus has been Nepali, Arabic speaking, Burmese, and now we added Pashto and Dari, Afghani communities as well. And those are our main targets just because they don't have the resources, whether it's medical, social, all the needs is there. And so our target is those populations, but it's open to the public, and we do provide additional language support for other Asian communities like Korean, Vietnamese, Spanish, and Mandarin as well. And then it's in collaboration to our 3 organizations. And there at the health fair, we're offering immunizations, health screenings, we have vision, we have acupuncture, and a lot of and then the vendors we have are also service-oriented that will come and meet with these individuals and provide like on-site, because that was also the feedback we got, is like a lot of the times these health fairs happen and it's just like a checkbox, right?
Absolutely.
Because they're checking out their busy schedule of work and childcare and what it is, and so now they have a space that they can get this connected to the resources, and also for the kids too, and the families. And so it's grown over time. I know when it first started, it was just like a small group, but now we're reaching like hundreds, 300 max. I don't know the numbers about last year, but
last year was close to 300. And we're also offering school supplies.
So we're trying to get as many resources and outreach as we can to these needed communities, especially on the language need, because I don't think there's other health fairs like this that can reach these folks.
Yeah. And of course, language access is such a vital piece to the health fair, and so that's why we'll have registration and community health navigators and other folks that will be there to help with anyone who needs to come in or who wants to come in with various language needs, and we will get everyone situated.
Yeah, I think this is the 3rd and 4th time we've had it here at this space. So it helps, like, you know, the trust is being built. They know what to expect, and it's the same orgs that's been working on this health fair. So we've gotten, I think, better and better. And then just having that and providing that translation and interpretation piece for majority of their needs. Like, we try our best and we try to improve. And so I think that's helped with the community connection that we've made.
Yeah. This is going to be really exciting. It's July 20th from 10 a.m. until 2 p.m. But Van, thank you so much for being here and talking with me.
Thank you for having me.
Yeah, it's such a pleasure to also work with you on this health fair. It's always been really nice. So thanks, I appreciate you.
Thank you.
I have a few community announcements to share. So as you heard in our interview with Van Doan, that the AAPI Community Health Fair will take place on July 20th from 10 a.m. until 2 p.m. at the Asian American Resource Center, where we are right now. All adult and children vaccines and school supplies are at a first-come, first-served basis, since our supplies are limited. We will also have health screenings, eye exams, acupuncture, and much, much more. And for those families in need of food, please visit the website sundaylunchbox.com, where you can apply to receive weekly access to their menu of minimally processed, locally sourced products at no cost. And all you have to do is to fill out their short application online, and they'll set you up. You can find their information in the description below for the Sunday Lunchbox program, who are doing their part to end food injustice in Austin. Before we go, here's a quick love note to all of you. Today, tomorrow, and every day after, I hope that you'll take time to appreciate yourself for all that you do to keep your life moving forward in the best way that you know how. You're doing your best, and that's a good thing. Life can be hard at times, so let's take the opportunity to also appreciate those around us, whether it's someone who needs some money or someone that you fall asleep next to every night. Well, that's the end of our show for today. Remember, our broadcast is available both on the Austin Public Health's Facebook page and the 8PH YouTube channel. If you enjoyed this programming, please be sure to like, share, and subscribe. Our show airs on the 4th Saturday of every month, so don't forget to click that bell icon on our YouTube page so you never miss an episode. Thanks for joining us, and be safe, be well, and be kind to one another.